Hi guys, today I'm going to be talking about diabetes disease. My name's Kira Russell. What are diabetes? Diabetes is the condition in which the body does not properly process food for use of energy. Most of the food we eat is turned into glucose or sugar for our bodies to use for energy. The pancreas, an organ that lies near the stomach, makes a hormone called insulin to help glucose get into the cells of our bodies. Some of the signs and symptoms of type 1 and type 2 diabetes are increased thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, irritability, blurred vision, numbness or tingling in the feet or hands, and sores. Type 1 diabetes occurs when your immune system, the body's system for fighting infection, attacks and destroys the insulin-producing beta cells of the pancreas. Scientists believe type 1 diabetes is caused by genes and environmental factors such as viruses that might trigger the disease. Type 2 diabetes, the most common form of diabetes, is caused by several factors, including lifestyle factors and genes. You are more likely to develop type 2 diabetes if you are not physically active and are overweight or obese. Extra weight sometimes causes insulin resistance and is common in people with type 2 diabetes. The location of body fat also makes a difference. Extra belly fat is linked to insulin resistance, type 2 diabetes, and heart and blood vessel disease. Type 2 diabetes usually begins with insulin resistance, a condition in which muscle, liver, and fat cells do not use insulin well. As a result, your body needs more insulin to help glucose enter cells. At first, the pancreas makes more insulin to keep up with the added demand. Over time, the pancreas cannot make enough insulin, and blood glucose levels rise. In type 1 diabetes, certain genes may make you more likely to develop type 2 diabetes. The disease tends to run in families and occurs more often in these racial ethnic groups: African Americans, Alaska Natives, American Indians, Asian Americans, Hispanics, Latinos, Native Hawaiians, and Pacific Islanders. Genes also can increase the risk of type 2 diabetes by increasing a person's tendency to become overweight or obese. Scientists believe gestational diabetes, a type of diabetes that develops during pregnancy, is caused by the hormonal changes of pregnancy along with genetic and lifestyle factors. Hormones produced by the placenta contribute to insulin resistance, which occurs in all women during late pregnancy. Most pregnant women can produce enough insulin to overcome insulin resistance, but some cannot. Gestational diabetes occurs when the pancreas cannot make enough insulin. As with type 2 diabetes, extra weight is linked to gestational diabetes. Women who are overweight or obese may already have insulin resistance when they become pregnant. Gaining too much weight during pregnancy may also be a factor. Having a family history of diabetes makes it more likely that a woman will develop gestational diabetes, which suggests that genes play a role. Genes may also explain why the disorder occurs more often in African Americans, American Indians, Asians, and Hispanics and Latinos. Diabetes can also be caused by genetic mutations. Monogenic diabetes is caused by mutations or changes in a single gene. These changes are usually passed through families, but sometimes the gene mutation happens on its own. Most of these gene mutations cause diabetes by making the pancreas less able to make insulin. The most common types of monogenic diabetes are neonatal diabetes and maturity, the onset diabetes of the young. Neonatal diabetes occurs in the first 6 months of life. Cystic fibrosis produces thick mucus that causes scarring in the pancreas. This scarring can prevent the pancreas from making enough insulin. And hemochromatosis causes the body to store too much iron. If the disease is not treated, iron can build up and damage the pancreas and other organs. Pancreatitis, pancreatic cancer, and trauma can all harm the beta cells or make them less able to produce insulin, resulting in diabetes. If the damaged pancreas is removed, diabetes will occur due to the loss of the beta cells. When food is ingested, it is broken down into smaller components. Sugars and carbohydrates are thus broken down into glucose for the body to utilize them as an energy source. The liver is also able to manufacture glucose. In normal persons, the hormone insulin, which is made by the beta cells of the pancreas, regulates how much glucose is in the blood. When there is an excess of glucose in the blood, insulin stimulates cells to absorb enough glucose from the blood for the energy that they need. Insulin also stimulates the liver to absorb and store any excess glucose that is in the blood. Insulin release is triggered after a meal when there is a rise in blood glucose. When blood glucose levels fall during exercise, for example, insulin levels fall too. High insulin will promote glucose uptake, glycolysis, the breakdown of glucose, and glycogenesis, the formation of storage form of glucose called glycogen, as well as uptake and synthesis of amino acids, proteins, and fats. In type 1 diabetes, the immune system attacks and destroys the insulin-producing beta cells of the pancreas. There is a beta cell deficiency leading to complete insulin deficiency. Thus, it is termed an autoimmune disease where there are anti-insulin or anti-islet cell antibodies present in blood. These cause lymphocytic infiltration and destruction of the pancreas islets. The destruction may take time, but the onset of the disease is rapid and may occur over a few days to weeks. Type 2 diabetes is caused by a relative deficiency of insulin and not an absolute deficiency. This means that the body is unable to produce adequate insulin to meet the needs. There is beta cell deficiency coupled with peripheral insulin resistance. Peripheral insulin resistance means that although blood vessels of insulin are high, there is no hypoglycemia or low blood sugar. This may be due to changes in the insulin receptors that bring about the actions of the insulin. When it comes to diagnosing someone with diabetes, symptoms of type 1 diabetes often appear suddenly and are often the reason for checking blood sugar levels. Because symptoms of other types of diabetes is prediabetes come on more gradually or may not be evident, the American Diabetes Association, or the ADA, has recommended screening guidelines. The ADA recommends that anyone with a body mass index higher than 25, regardless of your age, anyone older than the age of 45, women who have had gestational diabetes, and anyone who has been diagnosed with prediabetes should be screened for diabetes. As mentioned earlier, signs and symptoms of type 1 and type 2 diabetes are increased thirst, frequent urination, extreme hunger, fatigue, irritability, blurred vision, numbness or tingling in the feet or hands, sores, and unexplained weight loss. These signs and symptoms could be an indication of diabetes. You can test for diabetes with a test called glycated hemoglobin A1C test. This blood test indicates your average blood sugar level for the past 2 to 3 months. It measures the percentage of blood sugar attached to our hemoglobin, the oxygen-carrying protein in red blood cells. The higher your blood sugar levels, the more hemoglobin you'll have with sugar attached. An A1C level of 6.5% or higher indicates that you have diabetes. An A1C between 5.7 and 6.4% indicates prediabetes. Below 5.7% is considered normal. There are a few different ways to manage diabetes. Healthy eating is the key to healthy living. Physical activity is another important part of a diabetes management plan. But most importantly, medications such as insulin and other diabetes medications are designed to lower your blood sugar levels when diet and exercise alone are not sufficient for managing diabetes. The most effective medication for diabetes is insulin. Insulin is a hormone that your pancreas makes to allow cells to use glucose. When your body isn't making or using insulin correctly, you can take an insulin medication to help control your blood sugar. People with diabetes can run into trouble if their levels of blood sugar and insulin are out of balance. Low blood sugar or hypoglycemia can happen when they skip a meal, exercise more than usual, drink alcohol, or take too much insulin. Most people with diabetes can tell when their blood sugar is low because of early warning signs like shakiness and hunger. They need to treat hypoglycemia as soon as possible to stop it from getting severe, which can lead to a seizure or a diabetic coma. If a diabetic is in the middle of an episode, the best way to help them is to follow the 15-15 rule. Eat 15 grams of fast-acting carbs or 4 ounces of juice or even a tablespoon of sugar or honey and wait 15 minutes. If they don't feel better, have more carbs and test their blood sugar again. If left untreated, type 1 and type 2 diabetes is a fatal condition, and poorly controlled diabetes is a risk factor for chronic complications such as blindness, renal failure, foot amputation, and heart attack. But there is good news. In type 1 diabetes, the incidence of microvascular disease or damage to the smaller blood vessels and macrovascular disease, damage to the large blood vessels, can be dramatically reduced with tight control of blood glucose levels. If you can manage to control your condition well, the decreased incidence of macrovascular disease can persist for up to 30 years. The number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. The global prevalence of diabetes among adults over 18 years of age rose from 4.7% in 1980 to 8.5% in 2014. Between 2000 and 2016, there was a 5% increase in premature mortality from diabetes. Diabetes prevalence has been rising more rapidly in low and middle income countries than in high income countries. In 2016, an estimated 1.6 million deaths were directly caused by diabetes. Another 2.2 million deaths were attributed to high glucose in 2012. Almost half of all deaths attributable to high blood glucose occur before the age of 70 years old. Thomas Willis was an early pioneer of the treatment of diabetes. Greek physicians prescribed exercise, preferably on horseback to alleviate excess urination. Some other forms of therapy applied to diabetes include wine, overfeeding to compensate for loss of fluid weight, starvation diet, and more. In 1776, Matthew Dobson confirmed that the sweet taste of urine of diabetics was due to excess of a kind of sugar in the urine and blood of people with diabetes. The term diabetes was probably coined by Apollonius of Memphis around 250 BC. Diabetes is first recorded in English in the form diabete in a medical text written around 1425. It was in 1675 that Thomas Willis added the word mellitus to the word diabetes. Diabetes mellitus is derived from the Greek word diabetes, meaning to pass through, and the Latin word mellitus, meaning honey-eyed or sweet. This is because in diabetes, excess sugar is found in blood as well as the urine. The sweet taste of the urine had been noticed in urine by the ancient Greeks, Chinese, Egyptians, Indians, and Persians, as is evident from their literature. Joseph von Mering and Oskar Minkowski in 1889 discovered the role of the pancreas in diabetes. They found that dogs whose pancreas was removed developed all the signs and symptoms of diabetes and died shortly afterwards. In 1910, Sir Edward Albert Schaefer found that diabetes resulted from lack of insulin. It was in 1936 that Sir Harold Percival Hemsworth, in his published work, differentiated type 1 and type 2 diabetes as different entities. In 1982, the first biosynthetic human insulin, Humulin, that is identical in chemical structure to human insulin and can be mass-produced, was approved to market in several countries. There's no cure to diabetes just yet, but scientists are working on a groundbreaking weight management study to help people put their type 2 diabetes into remission. Thank you.